Tucker here, Zoom recording from my home with Westford's Health Director, Jeff Stevens, for our weekly COVID-19 update. Hi, Jeff.
How you doing?
I'm doing good. I'm doing great. Healthy, and that's all we can ask right now, right?
That's a plus. That means we're going in the right direction.
Absolutely. So we're going to talk some numbers and what's going on in town, what's going on in the state and the county. I've got a couple of questions I want to ask you, but we've been talking now for, 4 or 5 weeks, and I thought maybe viewers would want to know a little bit about your background, Jeff, and how you got into public health and landed in Westford as our health director.
Sure. I every now and again get asked that, and it was really initially when I got out of college in 1996. Public health wasn't necessarily on my radar right then and there. I got my degree from Fitchburg State in biology, environmental science, and I was really looking towards a career doing something more environmentally science, biology based, which at the time was really hard to find a job. So I ended up becoming working in a land survey company, running a survey crew for a couple of years, while continuing some other education at University of Lowell. I come from a family of educators and public servants in Central Mass, so I've always had a pretty close tie to cities and towns and to the people. So for me growing up, helping and working with people was pretty normal. When I got into public health, the reason why I got into public health was they were starting to lay people off in the construction industry, and my dad had heard about a job in the Fitchburg Board of Health that was open. I applied for it, and I did not get it the first time. I got it the second time through. I was the second candidate back then. That was 1998 or 99, I believe. And I started as a housing inspector. And when you're working in housing, in public health, it's a pretty tough field. So I got to see quite a few different cultures and community aspects of things that people don't normally see. While doing that, you obviously grow within public health, and you start learning more about the food inspections and what your public health nurses do. And there is a construction aspect with making sure apartments are remodeled properly and septic systems are done right, and looking at things like beaches. And even though I talked to the public health nurse then, I didn't know a lot about the public health nursing aspect, but you listened and you learned. And I spent 15 years working in public health in the city of Fitchburg, which at the time was around 45,000 people. I hit a point where I was happy with what I was doing, but a job offer showed up a job opportunity showed up that I hadn't really given much thought to, and it was the Director of Environmental Services job in the town of Westford. At the time, I didn't think I would get it. I applied for it, and I applied to the Westford Board of Health. I interviewed along with several other people, and I got a second interview, and I was thrilled to get that. And then lo and behold, they decided to hire me for the environmental services director, which I did that for about 18 months and started to cut my teeth in Westford and learn this community. And there is a complete apples and oranges difference between a city like Fitchburg and a town like Westford. So there was a learning curve and things that I needed to learn how to do. Well, it wasn't shortly thereafter that the former director retired, Sandy Collins, who was a fantastic mentor and a great leader herself, and who I still talk to this day and get advice from. She decided that she was going to retire, and I applied for the director's job. I managed to navigate to get that, and I've been doing the director's job for about 3 years. So it's been an interesting ride. I've got 20 years in public health at this point. I've been fortunate enough to see a lot of different aspects where I've immersed myself into the public health nursing piece so I can learn more about that. I've always had a strong environmental science background, which made the environmental services job when I applied very interesting. And the rest of in public health, you really need to be a jack of all trades, where you need to know a little bit about housing, you need to know about air quality, you need to know about water quality, bathing beaches, summer camps, restaurants, food manufacturing, environmental disaster, hazardous materials, and the list really can go on. And then it spills into medical reserve corps and running of your flu clinics and emergency dispensing sites. It's funny, you just never know what is going to be on the other end of that phone when you pick up that phone call. Through that process, I've picked up several credentials and certifications. I'm a certified food safety professional. I'm a registered sanitarian, which is one of the strongest credentials we have in our field. I still maintain a lead paint inspector's license, even though I don't do any lead paint inspections anymore. I did a lot of that in Fitchburg. And I maintain all my soil evaluator and system inspector licenses and practice that on occasion. And for whatever reason, I decided to become a notary public a bunch of years ago. They say you can make money at it, but I've never actually charged a single soul to sign something. I just do it because sometimes people need it.
Yeah, but that's a fascinating background. And, what I think I take from that is really, it's kind of what Gail Johnson, Westford's public health nurse, kind of said about herself last week. You guys are working in the background and residents don't know it. I mean, all the things that you just said that you have to keep an eye out on and handle and do. The average person just doesn't think about it. You go about your day and, you guys in the public health are really working in the background for the health and safety of the residents of the town. It's pretty cool.
It's a regulatory job that what we do, and there are days where we have to deliver bad news to people because they want to do something that falls outside the regulations, and there are days where that's not the case, where we get to deliver good news. And we try to, as best we can, use the regulations as a guideline and apply it to every situation, because not every single one is exactly the same. But you still have to maintain a level of consistency to make sure you're being fair for everybody, which is really what my office strives to do. And this particular office, I am very proud of. They are some of the most credentialed people in their field. And not only are they very well credentialed, they're also industry leaders in the fact that they are trainers. They sit on top of the highest boards and sit with some of the strongest public health groups, such as Mass Health Officers Association. Our Ray Dick, who's in our office, is in line to be the president of that group, which is a very influential group. I happen to be the comptroller of that group. We've got Gail, who is the vice chair of the Massachusetts Public Health Nurses Association. She's doing amazingly well and paying attention to that. I sit on top of the local and state advisory committee for emergency preparedness information. So we're very lucky to have the group that we have here. And Arnie is one of the ServSafe proctors for the region. And anytime there's a ServSafe class, he's teaching it. So we feel like we're always in the forefront of what's going on, and we have a hand in anything that public health has some regulation in. So we feel pretty good in this office when we're working on a lot of our projects. We've got a lot of resources, and everything that we put out there, we put a lot of thought into.
When you say Arnie, you mean Arnie Price, who is the Westford food inspector.
Correct.
I just wanted to clarify that for people who don't know who Arnie is.
Yes.
Thanks for the information. So why don't we start talking some numbers, if you'd like? We can have a update on Westford in Middlesex County, and then maybe the state.
Sure. So I'll start with the state because that's always the biggest number. And as of yesterday, there were 14,208 confirmed cases of COVID-19 in Middlesex County. And I always just go with Middlesex County. That's where we are. And that happens to be the county with the most amount of cases in it. We then, if I move down to Westford, to date, we have 118 total confirmed cases. There are 71 active cases and 42 people are recovered.
So up 18 from last week. Is that good?
The number always goes up, that's for sure. And the total number is always going to rise. We never subtract from it. The number that we always want to look to rise is the number of recovered cases. So I think we're up, I think about a dozen I haven't counted them, but I think about 12 from last week.
Yeah, we had 64 active last week and 32 recovered. So
okay, so 10.
10.
So we had 10 recovered, which that number we like to see grow as much as possible. And with our 71 active cases that we have right now, that number also includes places where there may be group homes and congregate living settings, such as nursing homes. So that number isn't 71 individual households. That could be several houses that have larger amounts of people in them, or facilities that have larger amounts of people in them. This virus is really taken a stranglehold on nursing homes across the state, and Westford is not immune to that, but our facilities are doing very well in those management of those cases. So we're very fortunate. We've got some very well educated and well prepared facilities in town, keeping those numbers down. So we're happy with everybody here right now, as happy as we can be.
So I was looking at some of the numbers, like on the Mass.gov website, and that's
sure, yeah.
full of some like really great information, and it breaks the data down by sex, race, age. So I was looking at Massachusetts. It looks like on April 23rd, that was sort of the highest number of cases in one day so far in Massachusetts. It was a little over 3,000, right?
Right.
And then I see on April 28th, it dipped down to about 1,500 people. But then yesterday it popped up a little bit again to about 1,900. So, so those, I just wanted to clarify, that's the number of cases confirmed on that particular day, correct?
Yes. That's the number of cases confirmed that day. And that is most likely, and I'm going to turn to just my computer so I can have it in front of me a little bit.
Sure.
We'll use the April 23rd date as an example. On that particular day, there were 14,614 cases that were tested on that day. And if you move to the amount of positives, there were 3,079 positive cases. So you can see that, and if you look across on this particular stat, the testing by date, the 14,614 cases was the most amount of cases tested or processed on that date. And that correlates with the most amount of positives on that date as well. That actually holds similar in a lot of days. So the more they test, the more positives there will most likely be.
Makes perfect sense.
Yep, just like Westford's numbers, you're always going to have that number of positives always goes up, but the recovereds should also slowly go up as well.
Gotcha. I like having you break down the numbers like that so people can understand. You know, you get numbers thrown at you, but that makes a lot of sense, and I've heard that as well. The more testing, the more positive cases are going to come up.
Exactly. So it's not necessarily a bad metric. It's just a metric that if you hear that there were 3,000 positives on one day, well, that may be tied directly to how many cases were processed. So it may not be more percentage-wise. It just may be in the entire curve. It just may be more that showed up with the amount of tests.
April 10th through April 20th was sort of a date that they had thrown out in Massachusetts, saying that that's where we're going to kind of have our peak. And what do you foresee happening?
Moving forward, that's difficult to actually say what will truly happen. So right now, the governor has extended the stay-at-home order till the 18th, and he's appointed a group of people that are going to look to possibly open up the state in phases. I can't imagine on the 18th that you're going to see the lights turned on everywhere and it's going to be just like it was. That will not be the case. It's going to be very much phased in. And I'm waiting to find out if municipalities may phase in at their own rate if it's more stringent. I don't know if that's going to be allowed yet or not. So what we're going to start with is we're going to wait for the recommendations, hopefully before the 18th, and we'll start making some decisions on what can be opened. Currently, in the Board of Health has closed things like the skate park and the tennis courts and the basketball courts and the playgrounds, which really, it's kind of gut wrenching to have to do that because the people that are using those places are the least likely to be infected. But at the same time, if they are asymptomatic carriers, they could very easily spread this virus to a more susceptible population. So that's really the reason. It's people have to think about the bigger picture and making sure that we're protecting the entire community. We don't operate so much in pods. That's
Right. I
all.
mean, they could be at the skate park and then bring it home to mom,
Exactly.
dad, grandma. Yep.
Or to somebody at the grocery store or
Right.
somebody wherever they go that may be an essential business. So it's painful. It's not any fun, but it's very much necessary. We're very fortunate that our numbers are not extraordinarily high in Westford, but I think we need to keep our foot on the gas with making sure we're socially distancing, wearing our masks as much as we can when we go out, and uh, taking our own responsibility to make sure we're doing those things. There are a lot of people that don't want to, and I understand that. I mean, I don't think any of us like wearing the mask, but it's the safest way that we can protect each other. So one thing I will tell you that the town of Westford is doing is we know the 18th date is out there, and it's now just a really 2.5 weeks away for us to find out what's going to happen. My staff is already prepping to open up other establishments by making sure we've got our checklist in place and making sure that we'll be in touch with any restaurants that may want to open. We're not sure to what extent yet. How many people will be able to go in? We're waiting for that guidance. When it comes to other non-essential businesses that are looked to be opened up, we'll wait to see what we're going to be asked to do. We'll be working in conjunction with the building department and other departments, I'm sure, to make sure those things happen. And I actually would like to take this time, when we get to the point where we open, I think, as you mentioned a little bit earlier, a few minutes ago, are we worried about a resurgence or a curve? I think there could be, because as places open, the social distance ability is going to shrink down. There'll be more people in more places again, which we could see our numbers just start ramping back up, which is going to make things like face coverings or masks, whatever you just decide to use, that much more essential.
Well, some towns are requiring it. It's mandatory and they're fining. And could you foresee that down the road if businesses start opening up? I know you talked about it a little bit in the Board of Health meeting the other night.
We did talk about it, and it is very much a possibility in Westford. I think we'll wait for the board to make that decision, but I really think it's something that we ought to consider moving forward. There are some people that there are two schools of thought. Some people don't think you need them, and other people think it's very much important. I happen to think that wearing them there's no downside. I can't find one downside to wearing the mask. It's something you have on. It protects you. Uh, why wouldn't you? Why wouldn't you not put the risk on? There are questions on how that will work. Some will be, how are you going to enforce it? That will be difficult. In fact, we may not be able to fully enforce it. I am not going to have anybody with a ticket book standing in the middle of Market Basket. There are people that may not be able to wear them that have COPD or other breathing issues that can't wear them. Kids under the age of 2 should not have them on. Some towns have said under the age of 5, they're setting their own parameters. So there are situations where people are not going to be able to wear a mask. And that's something that they're going to have to kind of grapple with, and we'll have to grapple with as well. But it's going to come up on the 11th when we have our board meeting. And there are 30 towns in Massachusetts that have orders right now. Westford has a resolution to strongly recommend. And that resolution may get converted to a mandatory order. So we will wait and see. I'm putting together some data to see what would make sense, and just looking at what our towns around us are doing as well. I think we should be, out of the 351 communities, I think we should be one of the ones that are considering this. It only makes sense, and it's really not that hard.
It's just keeping people safe.
That's all it's doing.
So anything else you'd like to tell the viewers?
I think right now I would just say, everybody in Westford, you're doing an amazing job at doing your socially distancing in a lot of cases. There are some instances where we've had to look into like certain fields where there have been a lot of people. Parents, I just urge you to make sure your kids are following the same recommendations. Work hard at doing that. We don't want to close any more down than we have to, but in the interest of protecting people, the board may have to do that. But it's not a direction we really want to go in. It doesn't make our life easier. It doesn't make anybody else's easier. So if people can just do their part, continue to socially distance, that's what we're looking for. And we're one day closer to beating this. We really are. I mean, when we started this back in March, May seemed so far away, and here we are on May 1st. So we're doing it. We're all doing it, and we're all getting there.
Yeah, it does seem pretty amazing that we've been holed up for this long, and yeah, pretty crazy times for sure. So Jeff Stevens, thanks a lot, Westford's Health Director, for your weekly update. We'll check in next Friday.
Sounds good, Patty.
Okay, be safe, Jeff.
All right, you too.
For WestfordCAT, I'm Patty Stalker.